Here we go. Hi, I'm Dr. Matthew Grierson. I'm with Sound Spine and Joint Physicians. I am a physiatrist, so I did my residency over at the University of Washington in PM&R. And after that, I did a year of fellowship in sports medicine. I work a lot with dancers and performing artists, so we've been looking for options that might be something you can offer in season. And a couple of years ago, I started learning more about Shockwave. And I learned about it because going to all of the meetings, my colleagues around the world would present all this research over at the Boston Ballet and over in New York. All the doctors out there would tout all the benefits of Shockwave. And I don't know, it took 2 or 3 years before I really started to catch on, I would say, over here on the West Coast. So I invited some folks out here to give me a demo, and it's actually been a real game changer over the last couple of years. I've almost cut how much PRP I do in half because so many people get better with Shockwave alone. And the great thing is you don't have to stop your game. You don't have to stop your activity to get ready for the performance this next weekend. With Shockwave therapy, you're introducing energy to a tissue. That energy stimulates the tissue, it stimulates the cell's machinery, it creates an inflammatory response that helps stimulate healing. It's just like if you cut your skin, those platelets cause it to clot off, but then they release growth factors. And those growth factors come to the area. Within a couple of days, you've got brand new healthy skin. And it's the same with Shockwave, is you're initiating that inflammatory response to help remodel that tissue. And so from a physics standpoint, you can develop that energy wave in different ways. One way is through what's called radial shockwave. The shockwave is just a really high energy pulse followed by very little energy. And it's that change in energy that stimulates the tissue. It doesn't damage it, it doesn't harm it. It just stimulates it enough to ignite that inflammatory response.
And stimulates it mechanically. Yeah.
This first treatment is just really to bring in some blood flow, some awareness to the tissue here. If someone comes in with like plantar fasciitis, we'll kind of treat all up and down the leg too. So we really like to work all along the kinetic chain. And then with focused shockwave, you're using an electromagnetic pulse to really help stimulate the tissue. Go over what is the focused. So this one has a little bit more energy to it. Inside there is a little electromagnetic bar. There's magnets in there. Electricity goes through those magnets. It creates a big energy wave that then gets focused. It goes down and then gets bounced back out. And so if I've got this tip on it right here, you can kind of imagine where that pulse is going to go. Whereas with this one, it's a wider, so it's going to go deeper. Whereas if I don't have anything on it, it's going to go like 10 centimeters deep, which is really good for that hip joint. Okay, you're feeling the burn.
On the burn.
Yep, we got another 30 seconds or so to go.
Great.
It is nice to kind of chat through things, focus on something different.
Yeah.
I do have a treat drawer at the end. So when people ask me, when do you do Shockwave, what are the best types of patients to work with, I usually think first of joint and tendon problems. Usually it's a chronic injury that just hasn't been getting better. It's someone who's probably worked a lot with their physical therapist or occupational therapist or trainer, and just they've hit a plateau, they've hit a brick wall. And the nice thing about this is it helps you push through that barrier to get back to the activities that you love and enjoy. So in terms of side effects from shockwave therapy, you can have a little bit of irritation, some redness of the skin, maybe some mild bruising. It's pretty rare that anything like that would happen. We do avoid areas like over the lungs because of risk for injury to the lungs. And of course, we avoid any areas of active cancer or infection, things like that. In terms of expectations after shockwave therapy, it's not an immediate quick fix. And so usually there's a sensation of euphoria, is what I call it, for a day or two after the procedure, where actually you feel a lot better. And sometimes that happens maybe in half the people, Some people feel a little bit more achy for a couple of days. But the real benefit is when you've got cells coming in, laying down new healthy collagen fibers. That collagen needs to cross-link, it needs to mature, and that process just takes time. And really it's 2 or 3 months after the last treatment of Shockwave is really where people start to notice the peak benefit. With Shockwave, there's some flexibility in terms of the number of visits, the frequency of how quickly you come back. If it's something like a tibial stress fracture that we're really trying to help stimulate healing, I might bring someone back 4 or 5 visits, 2 or 3 days apart from each other. But most people come chronic tendon, chronic joint issues. It's about once a week for 3 or 4 visits. And then I usually like to reassess 6 to 8 weeks later. And if they're doing great, well, we'll have them continue to do great. If things are going slow, sometimes we'll do another round or 2 of Shockwave. And if they're just not improving, then we've always got our other tools like platelet-rich plasma injections to turn back onto.
Congratulations for coming.
Oh, yeah.
That's the selling point.